Good morning. My name is Dr. Melody Medley Keith here at Lakeway Aquatic Physical Therapy. And today our snapinar is on hamstring pain. So how many of you out there, raising hands, have had hamstring pain? And it's a very, very common problem. And as I look across, I start seeing people say, well, I'm just going to stretch. I'm going to roll it out. I'm going to, get in. No. Again, what we do here in our snapinars is give you ideas of what you can do to help your pain. And in this case, hamstring pain. So I am a physical therapist, and my study is in movement and biomechanics. And what my studies do is takes the body and makes it into a lever system, into where that one lever affects the other. And that is what's going on with your hamstrings. The hamstrings are a huge muscle. We all know, right? In the back. And what happens when you get hamstring pain? You're crying, right? In pain. You're like, you can't even bend over. You're like, oh, my hamstrings are killing me. They're so tight. So you start bringing your leg up, trying to stretch them, and all that does is afflicts more pain into the pelvis. So remember that the hamstrings attach up into the pelvis, right? The pelvis muscle. So again, by us affecting the pelvis as well as hip joint proper, which is where your femur goes into, then we can relax the hamstrings and get them to be able to be more of hamstring muscle, which is not the dominant muscle. The dominant muscle should be your glutes, gluteus maximus, your buttocks muscles. So what happens is when your hamstrings are the dominant force and then you keep using them, overusing them, you lack pelvic mobility, you lack hip joint mobility, then the stress comes along in the hamstrings. And stretching just doesn't relieve them. Rolling is definitely not something you want to try. Although I see that all the time out there. All the time, roll. Don't roll them. What we want to do is to attack the pelvis. So we're going to get right to our exercises just so that you guys can see those exercises. And again, we have Amy here today. And what we're going to do is we're actually going to start on your stomach. Okay? She's like, all right. And if you'll go ahead and scoot back, kind of get your knees up. Okay? And if you can get in this position, guys, it's great. If you can get in this position with your knees up against the wall, that's perfect. If that's too much, it starts cramping, then back off of it a little bit. Don't go directly into that 90-90 right there. Okay, so now how are we going to affect the pelvis? Well, we're going to use a yoga block. And I'm just going to have it right here, and it's going to go right up underneath her pelvis. Hopefully I got that right if I didn't adjust it. Again, guys, it goes right here, right on the pelvis. And again, you'll see she's going to roll on it, kind of push. And she's really, really strong. She's a runner. She's a very, very top-notch athlete. She's going to laugh at that, but she works out a lot. So she's very strong. But what we want to do is to try to get in and move the pelvic bone, right? Very gently, yes, up and in and out. And again, you're going to do these 10 times, holding 10 seconds. So slow down. Don't go so fast on these. Nice and slow. And again, then you would take the block out. You're going to do the other side. You always do both sides. We're not going to do it here for the sake of time. All right? Then the next, so for those of you that kind of have a little bit of a back issue, what you can do is kind of put a pillow up underneath your hips. Go right in there and kind of goes on your belly and on your hips. Any pillow would do. Yeah, that feels good. See, it kind of helps the pelvis. But what this does is when we're going to now work on the hip joint proper into the femur. And this is that internal external rotation. and she goes out and back in. And notice she's going real slow. She's going as wide as she can. And then on top of this, after you do a few of these, 8 or 10 of these, then you want to try to go in and activate gluteus maximus, pushing the pelvis down into the pillow. Now, for those of you that have really bad hamstrings, guess what? This is going to cause some cramping. You might have to back off of bending the knees. You might have to back off of something. You might not be able to push as hard with your internal external rotation. But get up, walk around, come back, try it again, right? Because we're affecting the insertion and origin of the muscle by working with the pelvis and working with hip joint proper. Okay, now just relax, and the last one, of course, is to activate gluteus maximus. It's called gluteus maximus because it is a maximus muscle. Hamstrings should not be the dominant feature here. And so all you're doing is activating your glutes, pushing your pelvis into the pillow. That's why you got that pillow, so you can feel pushing it. Hold it 10 seconds and do 10 of them. Right? And you would need to do these for probably 3 or 4 weeks if you have very, very bad hamstrings. If your hamstrings are like, oh, I can't move, oh, I'm crying, oh, there is hope. And these exercises really help by going after what is really happening, not just stretching the muscle. That doesn't work. Rolling doesn't work, right? Okay, so I would love it, love it, love it if you guys would give us a thumbs up. And if you want to subscribe, we're doing these twice a month, Facebook Live. If you go to our website at www.lakewayaquatics.com, they are all on YouTube. So everything's on YouTube right there. All of our information is right there. And you can find out more information about everything we do here at Lakeway Aquatic Physical Therapy. I wish you guys have the best day today. Go out, keep exercising. Bye.